Now that we've reviewed our subjective data collection and objective data collection, let's look at validating that data and documenting it in this presentation on documenting care. Here are your objectives for the mini lecture on validating and documenting care. By the end of the presentation, you will be able to describe the purpose of validating and documenting assessment data. You will be able to describe the general guidelines for documenting data. We will actually document assessment findings in class, and you will use a technique called SBAR or ISBAR, which is Situation, Background, Assessment, and Recommendation method to verbally report client data to another healthcare provider. Remember, everything we do, we're doing conceptually, and the concept we're looking at here is professionalism, and the exemplar is documenting care. So validation of data is the process of confirming or verifying that the subjective and objective data that you have collected are reliable and accurate. This validation of the data that you've collected is very crucial to that first step of the nursing process. So you want to make sure that the information or assessment data that you've collected, you want to make sure it's accurate. You want to make sure it's reliable. And there are 3 steps of the validation process, which includes determining, first deciding whether the data requires validation, determining ways to validate the data, and then identifying areas for which the data may be missing. And again, the takeaway for this is if you don't validate the data correctly, any kind of error that you've error during your assessment is going to impact that whole nursing process, because the next second stage of that process, remember, is analysis, making sure that you analyze the data. So you want to make sure the data you get is correct or accurate. You do not have to verify every single piece of data that you collect, but there are certain conditions or instances that will require you to recheck and validate the information, right? So if you recognize that there is a discrepancy or gap between what the client is telling you, that subjective data, and what you see, that objective data, then you may need to validate it. If you see that there's a gap between what the client tells you at one point in the interview and then what he or she says later in that interview, that would need to be validated as well. And then lastly, anything that you find that is inconsistent with other findings. The book gives a great example of taking a patient's temperature, and the thermometer reads 104 degrees, which is a pretty high temperature. But you look at your patient, and she or he is cool, he's not flushed, he has no he's not sweating. He has no indication that his temperature would be that high. So those are inconsistent findings or abnormal findings that don't relate to one another. That gives you a moment to question it, right? So you pause and say, this might not be correct, and I need to validate that data. So there's several ways to validate your data. The first one would be to recheck your own data through a repeat assessment. I just gave you an example of a client that had a fever of 104, and if it was inconsistent or did not jive or correlate with the other findings, then you'd want to repeat that assessment. Take the temperature again, either use a different thermometer or a different method, different thermometer or a different area on the body, like axillary versus oral. Another method of validation would be to clarify the data by asking client additional questions. You can verify data with another healthcare professional. Ask someone else to come in and see if you are hearing what indeed you think you are hearing. And then lastly, you would want to compare your objective findings with your subjective findings. So if the client states that The book gives this example too. It's great, states I'm never in the sun. I use sunscreen all the time and I work in an office. I'm never in the sun. But then you're evaluating this client's skin and they have obvious tan marks. They have obviously sunspots. Then that would be a time when you would want to validate that data. So we've just talked about validation of data and making sure that our data is accurate and reliable. In addition to that validating, then we're going to document that assessment data. Both validating and documentation are crucial parts of that first step in the nursing process. And purposes, why we document. We document to provide a legal record of the client's care. We document so that information is communicated effectively throughout the or with different members of the healthcare team. So documentation is a vehicle of communication. It establishes a basis for screening or validating proposed diagnoses and acts as a source of information to help diagnose new problems. Documentation also offers a basis, if you will, of educational needs. So in the documentation, it'll tell you, or we are responsible for including in our documentation, any kind of needs that our client, family, and their significant others have as far as education purposes and what we need to communicate and teach our clients. It provides a basis for eligibility for reimbursement. And it's a legal record of the care that was given or not given to your client. Another big piece of documenting, or why we document, is that it complies with legal and accreditation and reimbursement requirements. So you might hear throughout your nursing career, nursing schooling, is that if you didn't document it, it did not happen. So I don't know if you've heard that yet, but documenting is very key, and it's come a long way since I started nursing school, and most of the documentation that you will be doing will be in an electronic health record, and different policies on documentation will vary depending on the healthcare system and the setting that you are in. So let's talk about what you document and when you document. How often you document will be determined by the setting in which you are in, your hospital or healthcare settings policies on how often to document, but there are two key elements that need to be included in every documentation: the nursing history and the physical assessment. So remember that nursing history is that subjective data that you gathered in the interview, and the physical assessment is that objective data that you gathered during your physical assessment data collection. It's real important that you realize that you only document what the client tells you and what you observe. You never interpret that data or infer information from the data. Only document either the subjective findings, what the client tells you, or the objective findings, what you observe. So there's some specific guidelines that you will need to abide by for documentation. And the very first one is keeping the information that you document very confidential. We talked about the Health Insurance Portability and Accountability Act of 1996 in the last I think the first presentation. You're going to want to make sure that anything that you document hand, if you're writing by hand, it's legible, we can read it, it's neat. And if you need to change something in your documentation, you never erase. You would draw a line through whatever word that was an error, you would initial it and write error. You use correct grammar and spelling. Only use medically approved abbreviations. And we will be going over some specific abbreviations that we can use. Avoid wordiness that create redundancy. Your book gives a great example of this. When you are going to be doing an abdominal assessment soon, you would not write something like auscultated gurgly bowel sounds in right upper, right lower, left upper, and left lower abdominal quadrant. Instead, you would document bowel sounds present in all quadrants. See how that's different? That's very concise and to the point. You're going to use phrases instead of sentences to record data. More guidelines for documentation. You would never write how you obtained your data findings, just what the data findings were. As an example, you would not document client was interviewed for past history of high blood pressure and blood pressure was taken. Instead, you would document client has a 3-year history of hypertension treated with medication and the blood pressure was 140/86 in the left arm. You want to write your entries objectively without making any kind of judgments. You can see some examples of this in your book, and we'll talk about this in class as well. In your documentation, you always want to make sure that you document that the client understands what it is you're talking about. So either the client understands or perhaps the client is expressing concern. You want to avoid recording the word normal for normal findings. We'll go over this over and over. So you would never write liver palpation normal. Instead, you would document no tenderness on palpation. You also want to avoid using terms such as good, fair, poor, sometimes. Instead, you want to be very specific and qualify or quantify things as possible. You want to record complete information and details for all the client's symptoms and experiences, and then any additional assessment content that is needed or applicable. And lastly, you want to record any objective data with specific observations during the physical examination. For example, when describing the emotional status of a client as depressed, follow it with a description. The client is dressed in dirty clothing, the client won't make eye contact, slumps their shoulders when you're speaking. So it just backs up your objective data, what you've observed. It backs it up with examples of what the client behavior is. This picture, if you will, is taken right from your book, Table 4.1, and gives some really good examples of the difference between using clear and concise documentation versus vague documentation. I really like the example of vital signs good would be a vague documentation. Instead, you write out what the vital signs are. Temperature 98.6, pulse 66 and regular. Respiration's 18 and blood pressure 160/88. Another really good example is that last one. Instead of saying voids a lot, you would write down what the urinary output is. So the patient has had urinary output of 3,000 milliliters in a day. That's very specific. It's very clear and concise documentation of the data. So up until this slide, we've talked mainly about documenting written documentation, but there are often situations in which nurses are required to share their findings verbally. And in order to do this in a clear and a concise manner, we use a format called SBAR. And you will hear this a ton. So I don't know if it's the very first time you've heard it, but you will hear it a lot throughout your nursing career, and you will be using this mode of verbal communication and hopefully becoming really good at it. But it's a standardized method of data communication. S stands for situation, B stands for background, A is assessment, and R is recommendation. The book here does not have the I included. Oftentimes, and we would like you to use the format I-SBAR, because before you get into the situation or what you're trying to communicate, I want you to introduce yourself. So, hi, my name is Melissa. Mary Lorno, 18 years of age, is experiencing a sudden chest pain. And then you go into the rest of the information so that you can communicate very concisely and to the point your assessment findings. Okay, so let's circle back around to our objectives. Hopefully now you will be able to describe the purposes of validating and documenting assessment data, as well as the general guidelines for documenting that data. And you will be able to use that SBAR method to verbally report client data to another healthcare provider. We'll be practicing how to document assessment findings in an electronic health record in class, and we'll be practicing how to use that SBAR method as well. As usual, let me know if you have any questions, and take good care.